So we're going to talk about midterm. And part of what we're going to talk about with midterm this afternoon is we're not only going to talk about the actual terminology, we're going to talk about prefixes, suffixes, and again, all that stuff that you probably didn't think you would ever use again. So, we got to understand key terms, we got to understand acronyms, abbreviations, and symbols. And the thing to understand when it comes to these, and I laugh, because a lot of times people will make up their own abbreviations. I've seen it. I've done QA, QI for a very long time, and that unfortunately is one of those things that you will see is people make up stuff as they go along. That is a very bad idea, especially when you get in front of a courtroom and somebody's like, what does this mean? And you're like, I don't even remember, because I was, 3 o'clock in the morning. So remember, we use approved abbreviations when we're using abbreviations, okay? So, in order for us to determine the meaning of an unknown word, we got to understand how the terms are formed, where they come from, and learning the definitions for parts of a term. Medical jargon is the big deal, okay? And this is how we get effective communication. We can use medical jargon. That's okay. We use it amongst ourselves, but we try our best not to use it with our patients. If we use medical jargon with our patients, understand that your patient may/may not quite understand what you're talking about. If you ask your patient, do they have high blood pressure, they'll probably understand what that means. If you ask your patient, do they have hypertension, they're more than likely not going to know. If you ask your patient, do they have pyelonephritis, they're going to not know. Yeah, so I mean, that is what that is. Okay, so be very careful about it. Okay, be very careful about it. So, A&P, anatomy of a medical term, okay? The anatomy of a medical term, okay, we're talking about changing or deleting a part of the word changes the word, okay? And when we change or alter any part of a word, it does cause the word to mean something different. These terms comprise, okay, the root word, in other words, where it comes from, okay, a prefix, which is the beginning of the word, a suffix, and then any vowels that make that word form together. Anything that makes it form together. Okay, so part of this is how they're combined. Accurate spelling is essential. You want to make sure that you're spelling correctly. If you're going to use a word, especially a big word, make sure you're using a big word right. A&P and the context of how words are used can help you determine what a word means. Okay, so root words. Okay. This is the main part of the word. This is the stem of the word. So if you think about it, your stem is the main part coming up out of the ground from any tree, any plant, what have you. Okay? This is the essential meaning of the word. It indicates where it comes from, what origin it is, whether it's Greek, whether it's Latin, whether it's Pig Latin, whatever it is. Okay? And adding anything to it or changing it, or changing a suffix, a prefix, what have you, changes the meaning. Okay? One of them that I always like to go to is like when we talk about lateral. Lateral means that it's on a side, correct? Lateral means it's on the outside. If I say something is unilateral, that means that it is on one side or one side of the outside. If I say it is bilateral, that means it is on both sides, okay? Or trilateral means it's 3 things that are in connection with one another, okay? So you see how changing just the prefix of that word completely changes that word, okay? And changes completely what the meaning of that word is. Prefixes have to do with location or intensity. So, like I said, bilateral, trilateral, unilateral, what have you, okay? A lot of medical terms don't have prefixes, but it does give it specificity when it comes to the root word, okay? A suffix indicates that it's a procedure, a condition, a disease, part of speech. And some of those, like I said, some of the suffixes that we use in medical terms, like I said, really change a word. And then, of course, we have combining vowels. And this just helps to make a word. It's usually an E, an O, an I, or an E that'll allow a word to form. And this is usually pretty simple. It just kind of helps us to get the word to make sense, or to sound like it makes sense, okay? Like I said, UN means one, but uni, lateral, is one side, okay? We had to add an I in there to make the two come together. UN is actually the prefix, but we added an I to join them together. That's the unifying or combining vowel, excuse me. Okay, so the prefix is at the beginning, the suffix is at the end, the combining vowels allow us to join the word just like an I does in the word unilateral, and a term has more than one root word, okay? So you may have a combination of things that'll create a word, okay? There's some words that change. Like I said, when you look at these, you have to add an S, you have to add an IS or an ES, EX versus IX, depending on it. Or like in the instance of apex. Apex is the point or the pinnacle of something, okay? Conversely, the apex of the heart is actually the lower portion, but it's not and there's an apex, but if there's more than one apex, it's an apices, meaning there's two of them, okay? Instead of apexes, right? So kind of have to change it in that way. Or using an A instead of ON, like ganglions, that's not a word, it's ova, ganglia, you know, some things that we have to do. And a lot of times, truthfully, those are things that we end up looking up, because at 3 o'clock in the morning, I may remember some of them, but I'm not going to remember all of them. And that's why we have those handy dandy pocket flip guides and Siri. So that's what those are for. Prefixes are there to give us, bless you, give us denominators, like things that declare something as something else, whether it's a number, color, position. Like I said, uni, what have you. That's one that I always refer to. And some of the ones you see here: uni, diply, null, prima, primi, multi, bi, what have you. Bless you. Okay. Some of the other ones that you may see for colors: cyano or cyan. Cyan is what? What color is cyan? Blue. Okay. So cyanosis is blue lips. Okay. Or bluing of something. Leuco is what? White. Erythro is red. Cero is what? Yellow and orange. Okay. And melano is what? Browning or brown or black. Yeah. So those are all, again, color differentiations. And then position, abduction, adduction. Duction means to move. Abduction means to move in one direction. Adduction means to move in another. Decrease, to circum, which means to go around. Peri means around. Trans means to change or to move away from. Epi, epidural means a layer below. Supra means a layer above. So, when you look at those, you have to, it helps you to kind of gauge those. And if you look in the back of, like I said, download that app. I promise you it will help you immensely. The Pocket Field Guide, Infomed Pocket Field Guide, or get one from Barnes & Noble. They're like $25. There's $10 for the app online. And I promise you, all this stuff is in there. It helps you immensely when you're writing a report, especially at 2, 3 o'clock in the morning. It's a great tool to have, right? And then we have our directional terms. And these are some that I always like to go over. Right and left. Obviously, we know, typically we know right and left. And I can tell you as a paramedic that every time that almost every time that I have to put on an EKG, I have to turn around, not facing the patient, but turn the opposite direction, so the patient and I are facing the same way, and say left, right, okay, and put it on. Not that I don't know my right from my left, but I'm looking at it just like you would from a picture. I take a picture, I post it on Facebook. I'm like, why is that on my left side of my face? But it's not. It's on my right side. And the reason for that is mirrored image. Okay, so when you look at your patient, you're looking at a mirrored image. You have to remember that. Okay, lateral and medial. Okay, lateral is outside, medial is middle. Okay, medi means middle. Proximal means closer to, So when we talk about the proximal humerus, that's up here. Distal humerus is down here at the elbow. Okay. Superficial means it's on the top. Deep means obviously it's deep. Ventral versus dorsal. What is dorsal? What does the word dorsal mean? The back. You're right. Okay. Ventral versus dorsal. Dorsal is the back. Because if you think about it, where's a dolphin's dorsal fin? On the back. Okay. Palmar versus plantar. Back of the hand versus the front of the hand. And then of course the apex is always the top. Okay. And then the base is the base, being the bottom, not the treble. Okay. Superior means nearer to the head. Inferior means nearer to the feet. Again, same as our previous talk proximal versus distal, or similar to. And these all have relation of one structure to another. That's an important thing to remember, that we try to relate things one to another so we can talk about proximity and where things are supposed to be. Okay? We talked about lateral and medial. I've kind of gone over all these already, but I'll just go over them again. These are body parts that lie farther from the middle versus medial, which are closer to the middle. Okay? Proximal and distal. Proximal means it's closer to the mid part of the body or the trunk, whereas distal is closer to the end of the extremity, or what they refer to as the free end. Superficial versus deep. That means something's closer to or on the skin versus underneath the skin, away from the skin. Ventral and dorsal. Okay, ventral and dorsal refers to the belly side of the body versus ventral is the belly side of the body versus dorsal is the posterior aspect of the body. Okay. More commonly, you'll see terms like anterior and posterior. Okay, A and P. So if you hear a doctor say they need a and P X-ray, that's anterior posterior. So they need to look at it from the front, looking towards the back. Okay, and that gives you a different view. They'll say they'll need a sagittal or lateral view or transverse view, depends. But they always want an A and P view so they can see what something looks like from the front, something looks like from the side, especially when it comes to the lungs, because it gives you different views. I was laughing the other day. I looked at, of course, Facebook. Who doesn't? And they had this picture of Prince William, and the picture of Prince William had him with his hand up, and he's holding his hand like this. And if you saw it from the side, this is what you saw. So you immediately thought he was holding up his middle finger, but when you looked at it from the front, you saw he was holding up 3 fingers, because for his third kid that they just had. So the view changes everything. Okay, and so that's why when they talk about anterior, posterior versus transverse and sagittal, they want you to look at all different sides of it so you can get a differentiating view of it. Okay. Palmar and plantar, we talked about those again. The front versus the front of region of the hand versus the bottom of the foot. And then the apex is the tip of a structure, like I said. And remember, the tip of the structure is not always what we would commonly refer to as the top, and the main one that we see that is the heart. Because the apex of the heart is where the left and right ventricle meet, down here in the left side of the chest. Okay? Whereas typically your lungs' apex is up here, but your heart's apex is down here. Whereas the top, the true top of the heart is up here, and that's what's referred to as the base of the heart, where the atria are. Okay? So it makes a little bit of a difference. You have your moving terms, flexion and extension. Flexion is bending of a joint, okay, making a muscle. You flex your muscle, that's the easy way to remember that. Extend is straightening a joint, okay. So I flex my muscle, I extend it. Adduction means I move towards the middle. Abduction, ab is out, away from. Add is to, I bring it to. Ab means to take away or move away from, okay? So adduction versus abduction. All right, we talked about the next two, bilateral versus unilateral. Bilateral means something's on both sides. Unilateral means it's on one side of the body. So if I say, oh, I've got unilateral weakness in my right arm, that means that the right arm only is the weak side. Or if I say I have bilateral pulses in the extremities, that means that the pulses on both sides are exactly the same. They're both good. Okay. We have some other directional terms that we commonly use when we talk about injury, but the big ones that we use are anatomical. And we talk about anatomical, we talk about prone versus supine. Prone means you're lying face down. And you'll see, like I said, your trauma patients, sometimes you see that. Supine means you're laying on your back. Fowler's position means I'm semi-reclining with my head elevated. There's a Fowler's position and there's a semi-Fowler's position. Fowler's position means I'm almost sitting at like a 30 to 45 degree angle. A semi-Fowler's position means I'm at exactly at a 45 degree angle. 90 degree angle is what's referred to as a high Fowler's position or right angle position. Okay, you'll hear those two terms kind of used interchangeably, high Fowler versus right angle. I have actually almost never seen anybody use the term high Fowler. It's usually right angle. Okay, I mean high Fowler is usually right angle. Okay, so in order to break a word apart, we have to kind of take a look at it. Okay, and we're going to use one here. It's a little more difficult, but we're going to look at the word nephropathy. Okay, nephropathy. Okay, well, we got to understand where the root is. Are there any combining parts? What does it all mean? So, P-A-T-H-Y, apathy means disease. So, when we talk about any sort of disease, okay, we always talk about something being, or even the study of a disease. If it's homeopathic, that means that we use things to try to create a homeostatic environment in the body. Away from disease. If you homeopathy or homeopathic, free of disease. Okay. The word nephro or nepher means N-E-P-H-R means kidney. Now I can take that root word nepher and put anything else in there. So I can say instead of using the kidney, we could use the liver. And we could say hepatopathy, hepato, which is your liver, and pathy, which is disease, liver disease, hepatopathy. Yeah, say that 3 times. Okay, or any other body part or Greek or Latin root word can be put in that same position with an adjoining word to try to create that. Okay. Another one, you'll see this one very commonly, dysuria. Okay, the word ia means a condition of, or the suffix ia is a condition of. Dys means difficult, painful, or abnormal. Dys means something is not right. Okay, and ur or uri is urine. Okay, dysuria means it hurts when I pee. Okay. All right, any question about that? Seems pretty simple, pretty straightforward. It's just learning how to break those words down because it'll help you to understand what it is a little better. And then hyperemesis. The word hyper means that something is excessive, okay? Hyper, we talk about a attention deficit hyperactivity disorder, ADHD, stuff like that. Hyper means something is over the top or more so than normal. Emesis is a root word that means vomiting. So we use the word emetus and vomitus when it comes to vomiting. Vomitus is the actual vomit itself. Emesis is the act of vomiting. Okay. So hyperemesis means you're vomiting excessively. That's that what do you call it? Exorcist type vomiting. Yeah. Pretty gross. Yep. You're spewing at that point. Okay. Analgesic. Okay. The word "an" means without, okay? Or the prefix "an" means without. A-L-G-E-S, alges, means pain, okay? So analges is without pain, and IC or IA is pertaining to or regarding, okay? So in regards to being without pain, okay? Or pertaining to having no pain. All right, so when we talk about an analgesic, we're talking about Tylenol, we're talking about Motrin, we're talking about pain meds and of any sort, and those are all referred to as analgesics. And analgesics means literally not having pain or involving not having pain. It's something you take to involve not having pain. Okay. Shorthand we don't use a lot of shorthand in our side of medical.